In many parts of Nigeria and Africa, traditional bone setters are the first place that people go to after they experience a fracture. And exactly what these people do and the consequences of their actions, we're going to talk about it in this video. Traditional bone setters, commonly known as TBS, are individuals that treat fractures, dislocations, and musculoskeletal injuries using traditional methods. Their skills are usually passed down through the family, learned through apprenticeship, or just based on cultural beliefs and experience. And despite advances in orthopedic surgery, many people still patronize TBS. And this is because of cultural trust and familiarity, fear of hospitals, fear of cost and money, and misinformation that all hospitals do is amputate. TBS typically manage injuries by manual manipulation of the bones, splinting with clothes, with wood, or with bandages, and applying pastes and oils and massaging the injured bones or joint. They do this without x-rays or sterile techniques and without understanding blood supply, nerve injuries, soft tissue damage, and fracture patterns. And that is where the danger lies. And so orthopedic surgeons usually do not recommend traditional bone setters because their actions can lead to complications like compartment syndrome because of tight splinting, gangrene, chronic bone infections, malunion or non-union, and eventually amputation. Many patients that eventually come to hospitals, they usually present late. There was a woman that came with a fracture of 1 year duration. She had already gone to a TBS and the bones, they had already malunited, so there were a lot of complications. You see, everybody's work is just made harder like that, and she was in pain too. Orthopedic surgeons use x-rays, sterile techniques, they understand anatomy, they understand soft tissue damage, they monitor a patient's health, and their aim is to preserve both function and life, because when it comes to trauma, guesswork is very dangerous. This is not an attack on culture, it's a call for patient safety. Delay can cost function and sometimes everything. So if you know that your great grandma or your mother or even an elder brother or an uncle that usually sees a TBS, tell them to stop and to refer to a hospital first. It is much safer. Send it to that person now. I hope you've learned something. Thank you for watching.